I'm Guy Slater. I'm a surgeon with Streamline Surgical. I'm also a medical director of the company. Over the last 15 years, we've really specialized in weight loss surgery, and that's proven to be very effective. But now we find lots of patients perhaps don't want to consider surgery at this time. They're looking for something that's less invasive, less permanent than surgery. And now they're really drawn to either gastric balloons or these new GLP-1 type medications that can be used for weight loss, such as Ozempic, Wegovy, Saxenda, and Mounjaro. So if we start with how the medication is used, I've got a Mounjaro pen here, and I think Mounjaro is probably the most effective in terms of weight loss. The active ingredient is a synthetic version of a naturally occurring hormone called GLP-1. It acts centrally on the brain by making you much less hungry, much less interested in food, and then it also acts on the stomach, delaying gastric emptying so that you feel full for longer. So how is it administered? You basically self-administer this to yourself once a week. You give yourself an injection and you get 4 injections worth in one pen. You start with a low dose of 2.5 milligrams for those 4 weeks. And at that point, if you're working with us, our dietitians will review you, and together you'll work out whether you should increase your dose to 5 milligrams. And beyond that, for 4 weeks on 5 milligrams, you then decide whether to stay on 5 milligrams again or increase to 7.5, 10 milligrams, and so on. So it's very straightforward to administer it. So if we compare that to placing a balloon, this is the swallowable version of the balloon. There are versions that you can place with an endoscope under sedation as well. But the advantage of this one is it really is just an outpatient procedure with you attending the X-ray department to have it placed. Within this capsule is the deflated balloon, and it's connected by tubing. And basically, and this isn't easy, in the X-ray department with a few gulps of water, you have to swallow that capsule down, taking further gulps of water to propel it down the esophagus into your stomach. And once I'm confident in your stomach, we then attach this tubing to a drip containing water and inflate the balloon to a volume of 400 mils. And this is the balloon here with 400 mils of water in it. And that sticks in your stomach, making you feel full because it's occupying space in your stomach and making you less hungry, less interested in food. And this particular balloon really stays in place for 4 months. And at 4 months, this biodegradable membrane gives way. The water drains out of the balloon and is absorbed like a glass of water, with the deflated balloon passing down through your intestinal tract and is excreted into the loo, like having a poo. And normally speaking, that's very straightforward. Now, the difficulty we found that although you can place these as a day case, they're not without side effects and difficulty. And quite a few patients had really marked nausea. Some had uncontrollable vomiting. Some really struggled with gastritis and reflux. And this was despite us using anti-sickness medication, despite us using all the latest sort of anti-acid medication. Some patients really struggled with retching and vomiting to the point where they became dehydrated. Some had to be admitted to hospital, intravenous fluids. 1 or 2, we had to get the balloons removed urgently because they were obstructing the stomach. And I think it's fair to say that it was really these side effects and risks that we just couldn't control despite medication that led us to fall out of love with the balloons. And we really stopped offering these a few years ago because we just found them so difficult. In terms of side effects, most of those side effects seem to be related to that delay in gastric emptying, that increased sense of fullness. So patients will experience some nausea. They may, if the nausea is bad, get some retching or vomiting. And I guess at least theoretically, if that was very severe, you could become dehydrated. But we've not really seen that to date. If you're somebody who suffers from heartburn and reflux, then it's likely that the medication will make that a bit worse too. Certainly at the higher doses, we're seeing changes in bowel habit with some patients suffering from diarrhea and some people with constipation. But what we found is that as long as you're patient with the medication, as long as you don't rush to the higher doses, then your body quickly becomes tolerant of the medication with the side effects diminishing just leaving you with that sense of fullness and that appetite control. But were they effective in terms of weight loss? I guess once you were over that initial difficulty with the balloon placing, they did work in terms of controlling appetite, and patients would lose about 5 to 10% of their body weight in that 4-month period that the balloon was in place. But the moment the balloon empties and is excreted, you will find that sense of hunger coming back, you'll lose that sense of fullness, and patients did mostly regain most of the weight they'd lost in the months after surgery. But in a way, I guess that's not dissimilar to the injections. So the injections are very effective, but only while you're taking them. When you stop the injections, that sense of fullness, that sense of appetite control will again disappear, a bit like the balloon, but these can be used for much, much longer. So in all the studies that have been published to date, they've been used for long periods of time. The studies on Mounjaro have been 2 years, and using it every month for 2 years, patients have lost 20 to 25% of their body weight. That really is an excellent weight loss, not far off surgery. I think it's really important that as part of using this medication that patients do have dietetic support. When you're losing weight that quickly, there is a danger of losing muscle mass, and you can minimize that risk by really prioritizing protein intake and exercising, particularly strength training. And that's where the purpose of our physiologist comes in, who can support you with tailor-made exercise programs. So in terms of effectiveness, patients can lose 20 to 25% of their body weight with this injection, compared to 5 to 10% with the balloon. In terms of cost, the injections now are pretty much on a sort of subscription basis, with you buying £1 a month at £200 a month. So a year's worth of Mounjaro will cost you about $2,400. 2 years will cost $4,800, and it's effective for all of that time. You compare that to the balloon, you'd have to go online to find an up-to-date price, but it's normally the order of about £4,000, although pretty much all the time you can get decent discounts to get the balloon down to about $2,400, which is probably a reflection of how much difficulty other providers are having selling it rather than its popularity. So in terms of which would I recommend, perhaps a few years ago I would have suggested a balloon, but that really was before these medications. We're finding these medications are so effective, they're so well tolerated, that it's very difficult to recommend the balloon at all. And certainly if I was a patient trying to choose between the two, for me it would have to be medication every time. I think it's by far the most cost-effective, safest non-surgical weight loss method.